Hi, I'm Susan Taylor with Scripps Health in San Diego, California. Pregnancy brings lots of changes to a woman's body. Yes, your belly's getting bigger, but pregnancy can also affect your respiratory system. Joining us to talk about respiratory conditions that women may experience during pregnancy and how to protect you and your unborn baby is Dr. Jennifer Namazy. She's an allergist and immunologist with the Scripps Clinic Medical Group. Doctor, thanks so much for being with us.
Thank you so much for having me, Susan.
Um, Go into a little bit more detail. What is the respiratory system?
Well, the respiratory system is not just the lungs. That's kind of commonly what we think about, but it actually is one large airway, also involving the sinuses and the nasal cavity as well.
And so, how does pregnancy impact these areas?
So, with pregnancy, as everybody knows, comes hormonal changes as the baby develops. And that can actually influence multiple organ systems, including the respiratory system.
Let's talk about pre-existing conditions. Let's say that you have asthma. What can happen during pregnancy?
Pregnancy can have a pretty significant effect on asthma. We used to think that about 30% of patients got better, 30% had their asthma stay the same, and 30% had their asthma worsen. But it's actually about 60% who have their asthma worsen and about 40% who have their asthma stay the same. So it's important to really identify those patients that can have asthma get worse during pregnancy.
And what are the risk factors?
Some of the risk factors include obvious ones such as smoking, but also having uncontrolled asthma before pregnancy. So it's really important to capture these patients, even in the childbearing ages, to help control their asthma before they get into the family planning stage.
Why would it get worse during pregnancy?
Well, there are all sorts of changes during pregnancy, but I think one of the most important ones that we really need to recognize is that patients are fearful about the potential effects of medications on pregnancy. And so there is data that show that a lot of patients stop their medications or even are told to stop their medicines.
So, the medications that you would take to treat asthma, is it safe for you to take those medications during pregnancy?
Generally, most of the commonly used asthma medicines are generally safe during pregnancy. But it's also very important to have this discussion with your physician. And so that you can come to a partnership, a shared decision making process to really make sure that you get all the facts and safety data as you proceed into pregnancy.
And what about the risks to the unborn fetus?
There are definitely risks of uncontrolled asthma or severe asthma on the baby. And these could be low birth weight, preterm birth, or small for gestational age, meaning they grow smaller, they have intrauterine growth restriction. They don't grow as well because they don't get the oxygen they need during pregnancy.
And what about shortness of breath during pregnancy? What would cause that? And particularly in the second and the third trimester?
If you do not have asthma or any history of asthma, and it's determined by your physicians when you come into clinic that you do not have asthma, you might be suffering from dyspnea during pregnancy, which affects about 50% of women in their second and third trimesters.
And what is that?
Dyspnea of pregnancy. And so that could be the hormonal changes that lead to hyperventilation, but also the mechanical changes to the body as the baby grows, leading to some shortness of breath symptoms.
And talk about the upper respiratory tract infections. They are caused by a weakened immune system during pregnancy. How do you treat that?
So pregnant patients are at an increased risk of upper respiratory tract infections, and that's largely due to changes in antiviral immunology. How you treat it is really depending on the type of infection. Some antibiotics can be safe during pregnancy, and the first that come to mind are the penicillins. But again, it really depends on your dialogue with your physician, the type of infection, how many days you might need it. These all come into factors in terms of which antibiotics to choose.
When you're talking about upper respiratory tract infections, what do you mean by that?
That's a very general term. So it could be a viral upper respiratory tract infection, or it can be a bacterial upper respiratory tract infection, such as bronchitis or pneumonia.
And then what about pregnancy rhinitis? What is that?
Pregnancy rhinitis is, again, due to the hormonal changes during pregnancy on the nasal membranes. It causes them to swell. So patients typically have very stuffy noses during that period of time when during pregnancy. But sometimes it can be very difficult to determine whether it might be due to allergies.
So it could just be a common cold during pregnancy.
It could be the hormonal effects, which is particularly just nasal congestion without any viral or other cold symptoms. It could be a viral upper respiratory tract infection, like we just discussed, or it could be underlying allergies manifesting in congestion, sneezing, runny nose.
So how do you manage it?
Pregnancy rhinitis is usually managed with saline sprays. Sometimes you can take decongestants when your symptoms are very severe, but it largely is very self-limited to pregnancy.
And then there are the acute respiratory conditions. How do you treat and manage, the flu, COVID, pneumonia?
These are very significant and sometimes very dangerous conditions that can affect patients that are pregnant and non-pregnant. I would say in the short term that really the treatment is not very different than the non-pregnant patient. It's really symptomatic and supportive.
Are there vaccines that are safe for pregnant women and for the unborn baby?
There's a great deal of data looking at the safety of COVID-19 vaccines as well as influenza vaccines and their safety during pregnancy, and they are recommended during pregnancy.
And can you take your COVID vaccine and your flu vaccine at the same time if you are pregnant?
You will be able to take both if needed.
What should you do before you get pregnant to lessen your risk for these respiratory conditions?
Like I said earlier, I think it's important to really form a relationship and a partnership with your physician. Start early during the family planning stages so you can review not only your chronic medical conditions, but also the medications you're taking and any other activities that you have, such as smoking, that can be addressed.
And if you have these conditions, what extra steps should you take to protect you and your unborn baby aside from stopping smoking?
I think it's important to stay adherent to the medications that are prescribed for you. And after reviewing kind of the safety data and the plan and the risks and benefits, it's important to have a healthy pregnancy, not only for your baby, but also for you. And to stay on those medications, especially asthma medicines, again, which medications that are commonly used are generally safe to use during pregnancy.
And if you don't get a handle on these things, doctor, what can happen?
Having uncontrolled asthma, for one thing, during pregnancy can lead to a laundry list of problems for mother and baby, including preeclampsia, preterm birth for mom. For the baby, it could lead to poor growth during pregnancy, preterm birth, and being small for the gestational age. Also, having COVID-19 during pregnancy can have adverse effects to both mom and baby as well. In terms of allergic rhinitis or pregnancy rhinitis, outcomes are largely not changed, but it really affects the quality of life for mom, maybe poor sleep or sleep apnea symptoms.
So the bottom line is to get in touch with your doctor before you get pregnant to map out a plan to, hopefully assure that you have a healthy pregnancy.
Right. If you, like I said, have any comorbid or chronic conditions involving the respiratory system, whether it be chronic sinusitis, chronic allergic rhinitis, chronic asthma, COPD, these are all important things to discuss with your doctors.
Any final thoughts, doctor?
I just wanted to stress the point that we're here as a partnership with our patients. We want to make sure that mom is healthy and happy during pregnancy and sleeping well as the growth of the baby is unharmed, and that we all lead to good outcomes.
Thanks so much, doctor, for being with us. We appreciate you taking the time.
Thank you very much again for having me come and talk to you.
If you want more information on respiratory conditions that women may experience during pregnancy, just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. At Scripps, we're here for good. I'm Susan Taylor. Thanks for joining us.